Watch the CN Tower on January 30th because it's going to turn orange, and get on social media and be active. Visit our website, the Canadian Network for NTDs, with lots of messages, ways to get involved. Depending if you're a student and young professional, every year we have an ambassador program that happens. So, keep an eye out for that. There's a global youth movement for NTDs that's being coordinated from Uniting to Combat, which is really exciting, and kind of looking at how to get young people involved in this space.
This is the Public Health Insight Podcast.
If you found out that there was a set of diseases that affected 1 in 5 people around the world and disproportionately affected those living in extreme poverty, maybe you would guess it was due to one of the big 3 communicable diseases such as HIV, malaria, and tuberculosis. Or maybe you would think it was a non-communicable disease like cancer. The reality is, you may have not even heard of them because they are considered neglected. Neglected tropical diseases, otherwise known as NTDs, contribute significantly to the global burden of disease. As World NTD Day approaches on January 30th, it's time to have a conversation to raise awareness about these neglected tropical diseases. This is the Public Health Insight Podcast, where you'll hear informative conversations about the field of public health and global health, including education, careers, and most importantly, issues that matter the most to our local and global communities. My name is LaShawn, your host for this episode, and I'm here with co-host Linda, Gordon, and 2 special guests who will be introduced shortly.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
Dr. Alison Krentel has been a researcher and consultant in public health since 1996, working in over 14 countries. Her research interests include facilitating community engagement, the use of implementation research to support health systems, and the translation of research results into programmatic action. She is an assistant professor in the School of Epidemiology and Public Health at the University of Ottawa and an investigator with Briere Research Institute. She is also the chair of the Canadian Network for Neglected Tropical Diseases.
Maneesh Phillip is the Director of International Programs at Effect Hope Canada. Maneesh has been working in the field of neglected tropical diseases, maternal, newborn, and child health, nutrition, health systems policy and programs for over 15 years in Asia and Africa. He has experience working with diverse partners, including governments, United Nations agencies, international and national NGOs, research, and academic institutions. Maneesh has a Master of Science in Public Health from the London School of Hygiene and Tropical Medicine, University of London, and is the current Vice Chair of the Canadian Network for Neglected Tropical Diseases.
Please welcome to the podcast, Alison and Maneesh. Welcome.
Welcome. Thanks for joining us.
Thank you, LaShawn. Thank you, Linda.
1.7 billion people around the world are affected by neglected tropical diseases, otherwise known as NTDs. As this presents such a huge issue worldwide, it's good that we have experts to walk us through this. Alison, Maneesh, what are neglected tropical diseases?
Well, my first reaction would be to say most of the names are not very easy to say.
Very true.
And they're a collection of 20 diseases and disease groups that have a singular commonality in the way that they impact people around the world. So they're helminth infections, which are worms, viruses, protozoa, different groups of pathogens that impact people.
Just to add to that is that these are diseases that, disable and disfigure sometimes and kill sometimes. And they are especially harmful for school-going children, adults, and they are diseases of poverty, as they are often called. Mm-hmm. So they affect people who are living in poverty, and they keep people in the endless cycles of poverty.
Mm-hmm. And just to add one thing, why we call them neglected, when HIV, AIDS, and TB and malaria, there was a big push with the Millennium Development Goals across those 3 diseases. These diseases just kind of got left out. They got left out from the Millennium Development Goals. And there's some research of Peter Hotez, who's in Baylor, calls NTDs the fourth leg of the table with HIV, TB, and malaria, because just of the sheer numbers and significant impact that they have on people's lives.
Right. I think you'd hardly find someone who says, I've never heard of HIV, but with NTDs, people always say, what are those? I've never heard of that. And even if you told someone, actually leprosy is a disease that still affects people today, I mean, most people are like, what do you mean? That sounds like an ancient disease. And so it's neglected, from like the health perspective, but there are people who are neglected too.
Comparatively speaking to like the big three that LaShawn mentioned, HIV, malaria, and was it tuberculosis? It seems like comparatively speaking, the mortality rate is lower. So that might be a part of the reason why it's referred to as neglected as well, because we in epidemiology we focus a lot on the mortality rate and maybe less so on the quality of life indicators that comes into play when we talk about morbidity.
Absolutely, Gordon. That's very right. We do focus a lot on the people who are dying, the mortality numbers, and we forget that people are actually dying every day from these diseases. They may not be actually dying as a statistic, but people living in disability, in people living with stigma and discrimination and isolation are dying a small death every day. And that's why it is so difficult to see some of the people who are affected.
And I think one of the things we're trying to understand more, and there's increasing amount of research and evidence is around the mental health burden, because all of those things that Maneesh just mentioned, stigma and isolation, there are significant mental health issues that people face as they live with this kind of disability for years and years.
And if you really talk about statistics, you talk about DALYs. NTDs have much higher disability adjusted life years than the big three, if you talk about it. And if you look at over a lifetime, also we look at the country's productivity itself. It has a huge impact with having a high burden of NTDs.
Right. And as you mentioned, it seems to be a lot of consequences associated with this huge burden of NTDs. What's interesting to me is, we're talking about a group of 20 diseases or disease groups. And of course, with that, there's probably different methods of, causes and transmissions associated with these diseases. Based on your experiences with working on some of these NTDs, maybe you can give us an example of some of the different causes or transmission pathways that go on, just to give the audience an example of what's actually going on.
I am actually, of all 20, we work in NTDs, but I couldn't give you transmission routes for all 20. I would confess to that. But for example, for some of them, there's like lymphatic filariasis, mosquitoes transmit the infection. So in some parts of the world, it's the same mosquito that transmits malaria. So a lot of the same risk factors for malaria you'd see for lymphatic filariasis, for schistosomiasis, which is also called bilharzia. It has to do with contact with freshwater bodies where there are snails, infected snails. So you can imagine a person who goes down to the river to fetch water or to wash their clothes or their bicycle can be infected very easily and repeatedly over the course of their lifetime. So that's just two, and there are others. I'm sure Maneesh maybe can talk of a couple as well. We won't go through all 20.
Yeah, and then there's the worms. That cause a joint disease that we call soil transmitted helminths, which are basically intestinal worms, and these affect a lot of people in every continent. And very interesting that you would probably not even realize or even think of that there are NTDs which we don't even know how they transmit.
Right.
Leprosy, one of the oldest diseases that we've known. We don't know how it transmits. There's Buruli ulcer as well. We are not 100% sure how it is transmitted. It is believed that it is transmitted through contaminated water. But these two diseases are ones which are still, not known to us.
So it almost sounds too like when we say the word neglected, we're talking about even neglected for resources in terms of research and funding. And then in turn, we don't have answers to some of these, like you mentioned, these diseases have been around for a while. And we still, something as basic as transmission, which is like the first thing to understanding a disease pathway, we still don't have the answers to those. So I think it's neglected in that sense as well.
And some guinea worm is one we're very, very close to eradication. So, some of them, there's been incredible progress despite the lack of resources. But those, as we get to the last mile of some of these diseases, we need more resources and to actually get there. And that's where the challenge is sometimes. It's at the front end, understanding the transmission and the research there. There's all the middle parts about the control that we need to happen, and then as we get to the end, are we able to really commit the resources that are necessary to really end the burden of some of these diseases or reduce them?
And all this discussion about these different, these 20 NTDs, and if I'm speaking from my personal experience with, learning about neglected tropical diseases, and like Alison kind of alluded to this at the very beginning, like some of these names are very difficult to pronounce, and I'm not sure if a lot of people are aware of them. But just to give some context, there are some diseases on this list that people may be more familiar with, whether it's rabies and leprosies like Maneesh mentioned, or leishmaniasis. So it's a very vast list, and there's a lot of different disease and disease types in there. I wanted to kind of shift gears and talk about the geographic disparities and distribution of these neglected tropical disease. So worldwide, around 149 different countries and territories are affected by at least one neglected tropical diseases. And so maybe you two can talk about the distribution of these neglected tropical diseases.
So I can speak from the perspective of lymphatic filariasis, which is the disease that I work in the most, which is when you have a long-term infection with lymphatic filariasis, you get lymphedema and elephantiasis of the leg, and so these sort of images that you see sometimes with people with very large legs, that would be one of the causes is lymphatic filariasis. And we see that disease. It was in the Americas quite significantly. Now it's almost completely gone from the Americas in Latin America. The Guyana and Haiti, a few countries still have infection there, and then it's across many African countries. A few countries are in the early stages of getting their elimination certified, which is wonderful. And then we see big, huge burden countries like India and Indonesia are two of the largest. They do represent the highest burden globally for lymphatic filariasis. So for that particular disease, if I think of a map of the world, I can go from Guyana all the way to Papua New Guinea and some of the Pacific islands like Fiji. It can just really span the globe. What we see with that one, and also soil-transmitted helminths or intestinal worms, is just in so many countries around the world.
Is this something we should only think lies in these countries that you mentioned, like low and middle income countries, or areas that are tied to poverty? Or is this something that, even in North America, for example, where we're located, are there some neglected tropical diseases here?
Well, scabies in downtown Ottawa, in the homeless population, you'll find scabies. So we do actually have, even in Canada, we can see neglected tropical diseases. And one disease we haven't talked very much about is Chagas disease, which is transmitted by a bug called the kissing bug. And a woman can actually pass that disease on to her child, her fetus. And so we can see in people who immigrate, from Latin America, from endemic regions there, who might immigrate to Canada and years later pass the infection on to their child. So, yeah, we are not, I would say probably no country in the world is immune from neglected tropical diseases.
Interestingly, so like Maneesh earlier had mentioned, these are diseases of poverty. And I found in my work in Calgary, amongst vulnerable communities here, specifically like refugee and newcomer communities, NTDs came up there as well. And I personally was surprised because though I knew it was a global issue, I didn't expect to see NTDs come up in refugee health, but it did. And so many newcomers are impacted by things like helminths and schistosomiasis. So I think that's like an even bigger incentive that it's a global issue. So like wherever there's poverty, we will see NTDs. So it's more incentive for us to try to really eradicate them.
Yeah, and I guess shifting gears a bit, we kind of talked about, the causes. We talked a bit about neglected tropical disease. And now from putting my public health lens and cap on, I want to really talk about what are the susceptible populations associated with neglected tropical diseases. I'm sure that you may have a lot of experience with, focusing on specific groups as we get to that last mile or that last stretch of elimination. So what kind of groups are we focusing on there?
So yeah, that's an interesting question, LaShawn. We know that these are diseases of poverty, but we know when people are living in poverty, they have very scarce resources. And when they have scarce resources, they are focusing on, things that are extremely important to them, things like food and shelter. And we know that often health comes after. Within a household, we know that, men and boys get preferential treatment. And so we know that, with these diseases, who suffer more are women and children. Mm-hmm. And it's a matter of choice when it comes to scarce resources, right? So we can see, like, over a period of time, even with COVID-19, we will know that, in terms of health-seeking behavior, that women and children are going to be left behind.
When you think about so many of these diseases have, when you're living in areas where water and sanitation is not adequate and not sufficient. So, you don't have access to running water. You don't have access to good hygiene, sanitation and hygiene. And so we also see those populations living at higher risk. And then if they do become infected, like with lymphatic filariasis, it's difficult to have to keep your leg clean, for example. And I just, a story that comes to mind, I was in a clinic in India we were doing a study, and a farmer he heard that we were talking about lymphatic filariasis, and he walked to come and see me. And this gentleman walked with his leg with lymphedema, quite bad lymphedema, and came to me and said, can you help me? And I said, well, no, I can't help you. I'm not a doctor. I'm not, even if I were, I'm not licensed to practice in India. And I talked to him I said, well, if you can keep your leg clean, and that will help you to, keep the swelling down and keep you from getting secondary infections. And he looked at me and he said, I'm a farmer. I can't wear shoes. I can't keep my leg clean. I'm in the dirt all day long farming. And it was sort of like this, it's always a wake-up call. We can sit there and say, oh, well, you just need to keep your leg clean or your eyes clean from trachoma. But if you don't have clean water, access to clean water, that's a very difficult public health message to pass to a lot of people living in the world.
So we touched on briefly some of the gender differences and how, women and children are disproportionately affected by NTDs. And I wonder if you could speak a little bit more about some of those gender differences in terms of exposure or even severity of NTD infection. For example, I wonder if some household tasks might present a higher risk of exposure, for example, like more domestic duties. You had said, for an example, Alison, contaminated water is a risk. I wonder if you could speak if you've noticed anything like that in your research.
So that's the one that comes to mind right now is schistosomiasis, and women often are tasked with fetching water and washing clothes and washing their dishes and things in the water, and the kids go down to the river with them, and of course they risk infection with schistosomiasis. Mm-hmm. What we understand is if there's infection with one particular kind of schistosomiasis, there's which is called hematobium, if you want to get scientific. If it's left untreated, it can cause a condition called female genital schistosomiasis. Mm-hmm. And that disease manifests in what looks like sexually transmitted infections. It manifests like infertility. It looks like something that it isn't. Mm. And so what you see, and there's very little evidence how many women actually have FGS, women and girls. Some of the estimations are around 40 million women and girls living in sub-Saharan Africa are living with FGS. It's a condition that has really just not been researched or understood at all. But what you have in practical terms is a young girl, and a woman researcher from Ghana. We work very closely with Professor Margaret Jaipong. She was involved in some research in this. They did some in-depth interviews, and a young adolescent girl talked about the symptoms that she had, and she went to the clinic, and the midwife or nurse or whoever she met with accused her of being sexually promiscuous, because the symptoms she had looked like a sexually transmitted infection. And this young girl sort of said, no, I'm not sexually active. This is what's wrong with me. And eventually, she gets treatment for schistosomiasis. So it's a condition that is being misdiagnosed and mistreated. And we're just scratching the surface to understand how that's really impacting women and adolescent girls in sub-Saharan Africa.
I imagine that could also lead to a lot of stigma as well, and people may not want to even seek treatment out of fear of reactions like the one you just described.
Or infertility. Like having children is such an important part of your identity in so many countries. And there are lots of traditional beliefs around women who can't have children. And so when you have a disease that's caused by a parasite, just because you simply were doing your job of washing your dishes or whatever, and there's treatment, we have treatment to deal with this. That's the amazing thing with these diseases is there's a lot of tools at our disposal that we can use to actually reduce the burden.
Mm-hmm. Speaking of that, we're talking about these neglected tropical diseases. What are some of the, prevention strategies we can incorporate, or maybe even some of the treatment regimes that are implemented to kind of get this under control?
Two main ways we treat or prevent neglected tropical diseases. Some of these are quite simple. One strategy is called MDA, or mass drug administration, and this is basically providing drugs for preventing some of the diseases like STH, intestinal worms, schistosomiasis, lymphatic filariasis, and trachoma. And they can be easily prevented by having medication once a year, or depending on the level, twice a year. Then there is another strategy called intensive disease management, or IDM, and these are basically diseases like leprosy or lymphatic filariasis, hydrocele, and elephantiasis, as Alison mentioned, which can be managed through intensive activity. And these are two main ways we can treat and prevent them. But in addition to that, there's also prevention through some wash strategies. Like in case of trachoma, there's something called the SAFE strategy. There's surgery, antibiotics, facial cleanliness, and just keeping your environment clean. And then these can be applied for preventing cases of leprosy, trachoma, and others. You need clean water. So again, a wash strategy that can be applied there. Some of these infections like STH and schisto or teniasis, leishmaniasis can be prevented with good sanitation and hygiene practices. And of course, the vector-borne diseases, just like malaria, you treat the environment and make sure that you have clean water in your environment, and treat some of those breeding sites. These can be prevented easily.
Right, and that's really interesting that you bring up that point, and you're talking about malaria, and that just, it makes me think, it's like, we have these neglected tropical diseases, we have malaria. Is there a lot of synergy going on within this space? Because it seems to me that these vectors that you're mentioning, they're common to both of the certain diseases in the NTD space and in like malaria, for example. So do you notice that synergy in practicality to kind of work together to reduce the overall burden of different diseases?
It's a great question. It depends on the kind of mosquito. So for lymphatic filariasis, some mosquitoes are not the same ones that transmit malaria, and some are. In those areas where you do see an overlap, so in some of the work we've done in Papua New Guinea, we expected to see much higher rates of infection with lymphatic filariasis than we did. And we think that maybe it's because there were high rates of bed net use in those areas. And so when you do have really good bed net compliance and people are using them every night, it can have an impact on lymphatic filariasis for sure. Dengue fever is an NTD. If you clean your environment up, you can reduce that vector, the mosquito vector breeding around your house. So I think there is some, and I think increasingly with the NTDs, we see more integration across, so that, where can we deliver treatment against lymphatic filariasis, soil transmitted helminths, and scabies, for example, with a new treatment called IDA. Synergies with other campaigns, it's very country dependent. It really depends on the programs, on how they communicate together, the timing and of their activities, their synergy of their budgets. There's a lot of factors that have to fall into place for NTDs to collaborate with other sectors. But I think that we're moving in that direction, and that's definitely what the WHO NTD roadmap that's just going to be launched this week. It's one of the things that it really calls for is increased integration and synergy across different sectors. So I think there'll be a real move over the next decade towards increased integration across different sectors.
And just in addition to that, I work more on the disease side of intensive disease management. As I said, there are diseases that are maybe diseases which have skin manifestations like leprosy, lymphatic filariasis, yaws, Buruli ulcer. What we've done in some of our program is we've combined them together and developed plans for them, looking at synergies of, for example, lymphatic filariasis and leprosy have some common things like keeping your feet clean. Some of the self-care that people need to do are similar, and so we've brought people together even in self-care groups where they can sit and practice them together at a health facility, learn that, and then go back home and practice it either together in their small self-care group or individually within their household.
Awesome. Those are some key points that you both raised about prevention and treatment. But I wanted to touch briefly on maybe some of those unintended consequences for some of the prevention and treatment, in particular, mostly the MDA, the Mass Drug Administration. I was reading that, if my understanding is correct, the point of Mass Drug Administration is because you avoid that cost of needing to diagnose and then treat someone and then giving them the medication. So we're potentially giving the medication to people who may not be infected with the disease. So when we're talking about things like emerging drug-resistant infections and stuff like that, where does that fall? Is that something that we're concerned about? Is that something where we have evidence for, or there needs to be more research done on? I don't know if any of you could speak to that.
Yeah, this is a great question. I posed this question to a colleague, a senior colleague, not within the last little while, asking that. Actually, to date, we don't have evidence of drug resistance. The drugs that are used are very safe. A lot of them have been around for a really long time, so we don't see levels of resistance for the drugs that are used for Mass Drug Administration, and the WHO does monitor that. These are. I think one thing we haven't touched on is these are donated treatments from the pharmaceutical industry. So for most of the what we call preventive chemotherapy drugs that we use for Mass Drug Administration are donated, which is extraordinary. It's one of the largest, I think it is the largest public-private partnership ever, when you consider that 1.7 billion people, live in areas where they could receive potentially Mass Drug Administration. So just the sheer numbers of tablets that go out every year. And also, some of these drugs have huge public health benefits. So even if, for example, ivermectin that we give for lymphatic filariasis, when we use it, it also treats lice and scabies. And so you may not have LF, but you have the other public health benefits to that treatment. So it's a good question though.
Mm-hmm. And it seems too that many of the drugs used don't require like a long-term regimen, like something like TB. People are on it for 9 months to 12 months. So I guess the non-adherence factor is not as much of an issue when there's like a single dose, or it's a short treatment regimen for why is LaShawn, are you laughing?
Alison has an answer for this, I'm sure.
That's like the last 10 years of my research career. How much time do you have, Gordon?
I'm an antimicrobial resistance person, so that's
So, it's a great question. And it's something I'm really interested in is, how do you get, and I often use this example, if somebody knocked on my door tonight in Ottawa, and LaShawn's heard me say this before, but, someone knocks on my door tonight and says, hey, there's this disease around, and here's, a packet of pills. Your whole family has to take it, and oh, by the way, you might feel a little bit sick or nauseous or get fever, if you're infected, but that's good. And I would be like, okay, how much information do I have about this? Have I heard about this in my community? Who's the person who's bringing me the drugs? Have I ever seen this person before? Do they have a badge? Are they believable? And so when you kind of translate that experience, and I kind of laugh and say, well, if we tried to do that in Ottawa, probably a lot of people wouldn't take it. So, with the distribution of these drugs really depend on the health system and how strong the health system is and how strong the network of volunteers are that we use to distribute these drugs, how well they're supported. And if the system works really well, you should have somebody who comes to your door who explains to you, what this treatment is and why you need to take it and why we all have to take it even if you don't feel sick, and this is where you go if you don't feel well. And if that whole system is in place, then the community member will swallow the drug in front of the volunteer, and we don't have to worry about non-adherence. But unfortunately, the world isn't perfect. So, we do have places where people take the drugs and put them on the shelf and forget about them, or maybe take half of them.
You just heard from Alison and Maneesh, two experts who are passionate about addressing the global burden of neglected tropical diseases. NTDs often take a backseat to the traditional big three communicable diseases, but a compelling argument has been made to consider them the fourth leg of the table to better achieve synergies across the broader context. The World Health Organization's Roadmap for Neglected Tropical Diseases 2021 to 2030 highlights the need for stronger accountability, intensified cross-cutting approaches, and a change in operating model and culture. As World NTD Day approaches on January 30th, 2021, the conversation must continue. Join us in the next episode as Alison and Maneesh continue to share their experiences as leaders in the field and more about how to get involved in the fight against NTDs. If you would like to learn more about NTD initiatives led by the Canadian Network for Neglected Tropical Diseases and Effect Hope, visit their websites by accessing the links in our episode descriptions. My name is LaShawn, your host for this episode. See you in the next one.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.